with special needs want government to establish a free healthcare policy for children with complex medical conditions for the first 5 years of their lives. Speaking at a summit organized by the Special Mothers Project, a mother of a child with Down syndrome, Madam Deborah Mangote, believed this initiative will help such children get all the necessary assessments and therapy recommendations and also help them get early intervention services. There's more in the following report.
Early intervention services for children with special needs have over the years been a great concern for parents and caregivers. This is due to the financial burden imposed on parents caring for such children. In the light of these challenges, the Special Mothers organized a summit to deliberate on ways of convincing policymakers to address these concerns. Speaking at the summit, mother of a child with Down syndrome, Deborah Mangote, called on government to implement free and comprehensive health insurance policies for such children, at least for the first 5 years.
How about making the health insurance policy free for parents with children with complex health needs? I mean, general, let's say for the first 5 years, so that you can, all the necessary assessments are done, recommendations for therapy and care are given to you, and then post 5 years, you sign on to some form of, because we need to make it sustainable for others as well.
Mother of celebrated software engineer Farida Bedwe, living with cerebral palsy, urged parents to toilet train their wards. Madam Lydia Bedwe believes this will help such children to integrate into society and also be enrolled in school.
But first and foremost, anyway, you should toilet train your children. If you don't treat them normal from the beginning, it becomes difficult. But it should always be fun and games. That's what they understand. It shouldn't be strict, sit. As she's sitting, you are also sitting, or the sister is also sitting. And when you finish, you flush, you say, oh, mommy has finished, and you get up. Because if you don't potty train your child, you can't leave your child anywhere with anybody. How do you expect somebody else to take care of it for you? It hinders the child's ability to go to school.
Mother of a child with osteogenesis imperfecta, Justina Yadombwachi, urged parents to leverage technologies available on the internet to make life much easier for their wards.
We all have phones. We all have YouTube. We can learn the basics and start them on our kids. We don't need to wait till they put these things in our centers before we can do something for them. So we can learn some of these things for ourselves. And you know what? We are trying to change the narrative. We cannot change the narrative by sitting down. We cannot change the narrative by just saying that I don't have pen A. So how best can I get pen A before the narrative will change?
Founder and Executive Director of Special Mothers Project, Hannah Awaji, says the communique will be sent to the relevant ministries, departments and agencies to inform their policy formulation on children with special needs. The forum provided an avenue for the special mothers to share their success stories